Bipolar disorder. It's a key word that's often used in conversation to describe someone who can't make up their mind. But what actually is it? According to the National Institute of Mental Health, bipolar disorder is characterized by clear changes in moods, with moods ranging from periods of extremely elevated, and energized behavior, known as manic episodes, to very sad, down, or hopeless periods, known as depressive episodes. It's more common than people think. Bipolar disorder affects approximately 4% of adults in the US. That's a lot of people to be affected by this disorder that stays with them for the rest of their lives. Yet many people label it as a scary disorder and refuse to have an open discussion about it. And since bipolar disorder makes the chances of a patient attempting suicide 20 times higher than the normal American population, this is a really bad thing to not talk about. So let's talk about it. As discussed, bipolar disorder is characterized by distinct changes in moods ranging from manias to depressive episodes, but this is more than someone being a little excitable or a little sad. In a manic episode, someone may partake in reckless behavior, become extremely irritable, have trouble sleeping, and be unable to think properly due to racing thoughts, whereas depressive episodes can cause someone to have very little energy, be unable to enjoy activities, feel empty, and sleep too much or too little as well. These mood swings can often cause people to make irrational decisions based on how they're feeling, whether that's making a very big financial investment, driving recklessly, or starting volatile arguments with those around them. These moods can last weeks or even months without proper treatment and care. But most importantly, it's the symptom of psychosis. Psychosis is a psychotic symptom that causes a person to experience hallucinations, feeling, seeing, hearing things that aren't really there, and delusions, believing things that aren't true. For example, someone may believe that they hear God speaking to them or that someone is reading their mind. People may often laugh at those who suffer from psychosis, but the truth is that it can be terrifying for those who are experiencing it and can lead to someone harming themselves. People may often laugh at those suffering from psychosis, but the truth is it can be terrifying for those who experience it. It can lead to someone hurting themselves. Psychosis is often common in other disorders like schizophrenia and can lead to discrimination and scrutinizing behavior from those who don't understand. In a study under BMC Psychiatry reviewing 202 people, 96 of them being on schizophrenic spectrum, 65 of them having major depressive disorder, and 41 being bipolar, the results have shown that 87.6% of participants had experienced discrimination in a 12-month period. The biggest areas of discrimination being in social, familial, and romantic relations. The study also showed that the groups that experienced a higher level of discrimination were either older, mixed race, or female, possibly due to internalized stigma. The intense amount of discrimination individuals experience is proving to discourage them from participating in daily activities such as getting a job, having healthy relationships, or even finding a place to live. The stigma people have around mental health issues, especially bipolar disorder and symptoms like psychosis, have proven to negatively affect people who have this disorder. In the media we are fed are partially to blame. The truth is all these movies depict the worst of the worst, the complete polar opposite of the best case scenario. If so, many people are diagnosed with bipolar disorder. How come they aren't filling the biased role society set up for them? Well, treatment, of course. Bipolar disorder is a genetic disorder that affects the brain, and influences of psychological problems can trigger manic or depressive episodes. One of the ways it's treated is through medication like mood stabilizers and psychotherapy. Medications like antidepressants such as Zoloft, Abilify, and Dopamine, and atypical antipsychotics like Clozaril, Risperdal, and Seroquel are often added with mood stabilizers to help with other medications. Psychotherapy, also known as talk therapy, helps a lot with keeping track of what causes episodes and help people work through their problems that may be influenced or even completely unrelated to bipolar disorder. And alongside taking medication, this helps a lot of patients learn healthy coping mechanisms and how to tackle daily life even if they're mentally ill. People with bipolar disorder are completely capable of living normal, healthy lives as long as they follow along with treatment plans and come to terms with their diagnosis. It may be scary at first, but if you're suffering from bipolar disorder, accepting who you are is often the first step required to getting better. To be honest, there isn't enough talk going around about people who suffer from bipolar disorder and many other lesser known personality disorders. For as much as we laugh at people and call them crazy or bipolar, and as much as we drop the word psychopath for every person who acts violently or even abnormal, we refuse to talk about what those words really mean. In the defense of mental health, to misdirect from other topics is unfair when you see how little is actually being done to help people who have psychiatric disorders. Society is willing, even if it's kind of reluctantly, to discuss depression and anxiety when it comes to mental health awareness, but rarely do personality disorders come up without having a connotation of violence around it. People are often afraid to touch personality disorders. After all, who wants to have a conversation with a psycho? But lack of conversation leads to ignorance, and ignorance leads to bigger problems. Bipolar disorder is one of the many disorders that deserves a bigger spotlight when it comes to mental health, and I think it's time we as a society give it the stage.
For this project, I really wanted to answer the question, what is bipolar disorder? It was an important question to me personally that I found myself dedicating to answering as someone who suffers from bipolar disorder. A lot of this research hit close to home as I found a lot of content I related to, and since my most chronic symptom is psychosis and I used to be a passionate horror genre fanatic, realizing how much of it was making a mockery of my everyday struggles hurt. But it was also comforting that throughout my research I saw tale after tale of heartwarming stories of recovery, and it was a reminder that things get better. There's literally so much I wanted to cram into this, but I wanted to make this video animated and I didn't have enough time. And it was frustrating deciding what to put in and take out as there was so much I wanted to talk about. But enough about my emotions, let's talk references. This BMC psychiatry article discussed the most amount of discrimination over a large sample size of people with bipolar disorder, schizophrenia, and major depressive disorder. It summarizes that mostly everyone in the sample size was affected by some form of discrimination over a 12-month period, with a more prominent amount of discrimination presented in maintaining different types of relationships. I chose this as it was a scholarly article that discussed the effects of discrimination, and it became important when addressing my point about horror movies and the bad images people with psychiatry disorders are given. The Bipolar Disorder Survival Guide was more of a self help book discussing how to handle having bipolar disorder using real life anecdotes of people who had it. It doesn't really get too deep into the science behind bipolar disorder, but discusses many of the ways of coping and understanding disorder both as a patient and a family member of the patient. The book became important for when I was discussing medication and other treatment options. It was written by a psychiatrist, and with my own personal experience with therapy and medication, backed up a lot of what I already knew. The American Health and Drugs Benefits article was more of a recap of a lot of the past evidence about bipolar disorder and summarized a lot of basic information. It was categorized by how many people were affected and the toll it took on them economically and socially. This was useful for how some baseline statistics that I could use to answer many of my main questions about what bipolar disorder is. I was also able to work off some of their main points to further any conclusion about stereotypes. The National Institute of Mental Health had an article called Bipolar Disorder. The majority of the page was outlining the basic knowledge of bipolar disorder, such as what it is, what can be used to treat it, and the textbook definition of the disorder. It was more of an overview of everything that I would further develop and can base my point off of. That became an important article to my entire piece as I couldn't really develop a point without having the most basic understanding of what my own disorder was. I knew from personal experience what it was like to have it, but this article helped me present a lot of what I knew into straightforward statements and terminology.